Good afternoon, everybody, and welcome to the Choosing Hope 2 webinar series. I hope you're having a great day so far today. As you know, the series was developed to support our healthcare and service providers who've worked so hard to tackle addiction issues before and especially during this pandemic that we're all suffering through. We are so glad that you're here today. I'm Lisa Green. I'm a program coordinator for the Western New York Rural Area Health Education Center. And just a few things to note before we get started. You know that the chat box is open for introducing yourself and for any questions that you have. I'll be watching the chat box so I can ask Julie questions when they're hot on your mind. If you have any comments, please put those in there as well. It really makes for a great, engaging, and interactive webinar when we're talking to each other. I know that this is your lunch hour. If you can stay on, that's great. If you have to leave after a certain amount of time, just know that this will be recorded and you'll be able to see those sessions and hear the sessions on our website, and I will be sending out the link after the presentation. I'll also send out any PowerPoints that we show on the presentation, so you'll get access to all the materials probably by the end of the week. Again, if you have questions or you'd like to connect with Julie, our presenter, at the end of the program or anytime really, you can always email me at lgreen@r-ahec.org or call me at 786-6275. I'd be glad to answer any questions or connect you with Julie. So today's session is titled Billing and Coding Considerations, and also we're going to talk about COVID-19 impacts on opioid use and on treatment. Our presenter will be talking about how providers can best handle billing and coding as they relate to opioid use disorder. She'll be answering questions you folks have about any of your billing or coding issues that you might be having at your organization. If you want to ask some questions, pop them in the chat. And some impacts that the pandemic has had on opioid use and treatment options. So let's meet our presenter. Julie Gutowski has been at Spectrum Health and Human Services for over 10 years. She's a licensed mental health counselor and has more than 20 years of experience providing services to individuals who have behavioral health challenges. She started at Spectrum as a care coordinator in the reentry program and was afforded many opportunities for growth throughout her service there. Currently, she oversees the administrative rollout of new services, seeks opportunities to develop new services, and also serves on leadership committees throughout Western New York. So welcome, Julie. We are so glad that you are here today.
That's a weird little warning from my computer, but I'm sure it's all going to work out. So thanks for joining me today. Really wanted to talk about how to most effectively address billing related to substance use disorders, specifically to opioids, but honestly, any substance that the individual has problematic use as a result of. So thanks for joining me. And in the last couple of weeks, there was great news. I kind of wanted to share it with everyone. So for those of you guys who have been working with OASAS for any amount of time in the last couple of years, you probably are familiar with or know the name Rob Kent. He was the general counsel for New York State OASAS for many, many years. A huge proponent of addiction services, of supports, really of recovery as well, looking at really helping and providing supports to providers, but also really with a good understanding of what people who have a substance use disorder need, want, and some services that would help them. So Rob was with OASAS for many years. I think he left about 6 months ago. And in the last couple of weeks, it came out that he is now general counsel at the White House Office of National Drug Control Policy, which I am personally very excited about because he is such a huge support of providers and also individuals and families who are dealing with a substance use disorder. So I wanted to start on a positive note. Here we have some APG services, and we're going to go through some of these briefly. It's all written down in a PowerPoint format. So if you want a copy of that, either Lisa can email them to everyone who's participating, or if you send her an email, I'm sure she would be more than willing to get you a copy of the PowerPoint presentation. So the reality is, at this point, what are we at? We're at about March, probably about literally 365 days ago or a year ago this month. All of our lives had a huge change. The change was not invited in, it wasn't welcomed, it wasn't requested. So something happened and our entire community and all of our lives were changed. So we all know how that impacted us personally, but there were also a lot of impacts of COVID-19 for individuals who were working or trying to get behavioral health services. And some of the impacts of COVID-19 were at an increase in substance use disorder relapses. So individuals who may have had prior to COVID many years abstinent, and abstinent, I mean not using their drug of choice or any type of drugs, including alcohol. So really with COVID, it seemed that there was a pretty dramatic increase in the number of individuals who relapsed, returned to use. There was also not as much in some of the rural counties, but if you looked at the nation as a whole, there's a pretty dramatic increase in the number of opioid overdoses. And when I'm talking about opioid overdoses, I'm really referring to the overdose where the person ends up passing and is not able to be brought back. So those are two really big, huge impacts of COVID in the population or the people we work with. Why did those two things happen? I don't know. I have some ideas, and I think some of the impacts I'm going to kind of go through below might have increased or really is directly correlated with the increase in individuals who relapsed back to use and those who suffered an opioid overdose. I need you to think about when our entire world kind of got flipped, how that impacted us, but also how it impacted the services and supports that were being delivered by community-based organizations and also by law enforcement and criminal justice agencies. So prior to COVID, a lot of individuals who are in treatment for substance use disorder have a connection to either law enforcement or the criminal justice community. And so as part of that, there typically are kind of check-in appointments that happen, as I'm sure you're aware. It could happen weekly, it could happen monthly, every 2 weeks. And some of that was telephone check-ins, but really a lot of it was face-to-face. And law enforcement officials and criminal justice agencies like probation and parole would obtain urine toxes from individuals from time to time. When COVID happened, that ability was drastically reduced. Sometimes I'm not saying that people stay abstinent or sober because they have a criminal justice connection. What I'm saying is a criminal justice connection can be a huge support for someone's recovery. I want you to think about this. Imagine, if you will, for just a few minutes, you won the lottery and you're a bazillionaire now, okay? And you love your job, like I do. So this is human nature. I would keep my job and I would do what I'm doing right now because I truly love my job. But then what would happen is it would start out kind of like this. It's my birthday and it's a Wednesday. And I work so hard, and really I'm not, I'm kind of doing it for free because I'm a bazillionaire now. So you know what? I think I'm just going to take off my birthday. And then it's Thanksgiving, and then it's the day after. And then what happens is we're moving into holiday December season. So it might be Christmas if you celebrate, Hanukkah if you celebrate, Kwanzaa if you celebrate, then you have New Year's Eve. So I'm kind of taking off a little bit more at a time. And then pretty soon, because I don't need the support of reimbursement, i.e. my paycheck, I'm missing a lot more work than I would if I didn't win the lottery. So how do those two things connect? I come to work because I love my job. However, I also come to work because I have bills to pay and I have a lifestyle to maintain. I have a car, a house, dogs to take care of. Okay. So because my getting a reward or a benefit is tied to my coming to work, I come to work. I love what I do, but I come to work because I have that support. Somebody who's connected with criminal justice sometimes follows through with treatment because it's a requirement and they're paid in their freedom. And the supports occur first more frequently when somebody gets out or is first on supervision. And so what happens is my PO might come to my house and see me. I'm doing well. I'm abstinent. There's no drugs or alcohol in my home. I'm able to maintain employment. Things are going well. So my PO will continue to see me, and I'm getting reinforced by them coming and saying, you're doing a good job. You know what? I'm going to stop coming every week. I'm going to come every 2 weeks. Since criminal justice agencies really had to redesign how they provide support and supervision to individuals, I think that increased the relapse rate for some individuals. Another impact of COVID-19 is the increase in basic needs. And what I mean by that is, if you are struggling financially and you're able to meet all of your basic needs, and COVID comes, and we say, you should go out now and get Lysol, you should have hand sanitizer with you, you need masks, you should have extra bleach. If you can, you should store like a couple weeks worth of dried food items. So that was really an increase in basic needs. And for some individuals that we work with, they don't have those additional resources. An extra $10 in toilet paper and Lysol is not attainable at this time for them. Add to that the transportation issues. During the peak of COVID, especially in the spring, transportation was drastically decreased our options. Some transportation companies weren't even providing taxi services, right? Uber wasn't as available back then as it perhaps is now. So that lack of transportation is a huge barrier for people to continue in their recovery. Then add the decrease in face-to-face professional supports. Julie, what do you mean, decrease in face-to-face professional supports? The people that we work with oftentimes either go and get help, extra services from, let's say, community-based organizations and also government agencies. So somebody might be connected with Child Protective Services, or they might be part of kind of a food pantry situation. And so that ability to kind of go face to face and get that support at the service provider really was cut way back. Also really cut way back was the decrease in face-to-face supports that actually were coming into individuals' homes. Okay, Those supports, although sometimes individuals receiving them might think that they're annoying or not particularly helpful, that additional support helps the family and the individual kind of maintain the track where they're making progress. And when you pull those supports away, there's an increased stress. Think about some of the people we work with that they had children with challenges, and we had staff providing waiver services coming into the house or providing therapy in the house. And a lot of that was really cut drastically back. And another impact for COVID was the need for personal protective gear, gloves, masks, face shields, gowns. We couldn't get it. It didn't matter if you had a lot of money. At some points, you just couldn't get the things you needed to stay safe. That does what to a person? Causes stress. So this is a mantra that I've heard a lot since last March. Under stress, we all regress. Under stress, we all regress. So individuals we're working with who had 5, 10, 15 years abstinent, sober, had all of these additional stressors placed upon them. And when that happens, when we're feeling under stress individually, we might go back to old coping skills because they were effective. Here we go with the additional and increased stressors, the unwanted change. Our entire life and the way we do business and our normal was really changed in a very short period of time. So what are the additional stressors? Well, now I have to work from home, and I've got 3 kids who have to do their schoolwork from home. And if you have children, depending on their age, they're not necessarily super great at being able and willing to remain on task all day. So then as a parent, I'm trying to do my job from home, or I have to leave and do my job in the community and be nervous, while trying to make sure that the children I'm responsible for, my family, are doing what they need to do so they can remain in school. Working in the community, who would have thought that a grocery store cashier or bagger would be considered an essential employee 3 years ago? But it is, because we all need to eat. So those positions are really important. And so if I do work in the community and I'm an essential worker, I have usually an increased stress level, and I'm worried and anxious that maybe I'm going to get ill, is one of the concerns. The other concern that many people have is, what if I'm ill? What if I have COVID and I don't know it, and I pass it on to someone else? Again, these are additional increased stressors that many of us and many of the people we work with experienced. And under stress, we all regress. If you are working from home, the struggle of maintaining the balance between work and home life for many people was obliterated. There was it's kind of a blur. We see jokes and we see memes like, during the day, I'm working from home. And so how I transition is I instead of sitting on the couch in my living room like I do when I'm working from home, at night I move to the love seat in the living room. So really, and for me, memes really come from, there's that element of truth. So when your work becomes your entire house or a room, how do you separate those two things? And how do you decompress? Another challenge with COVID is many of the people in mental health and addiction services were working on and had developed coping skills. And so there was a routine to it. So if somebody was very active in Alcoholics Anonymous, Narcotics Anonymous, SOS, or a faith-based recovery group that would meet face to face, that became like a second family and an absolute critical piece of a lot of people's recovery and support plan. And at the beginning, we weren't sure in the recovery community, how do you make that happen? How do you do those supports? So when your support is to go to face-to-face meetings, and now all of a sudden you have to go online meetings, you lose something there, okay? When your coping skills include going to the gym 3 times a week, but the gyms are closed, then what? When your coping skills are that you go and you have coffee with, the people from your support group, but you can't sit down in a restaurant anymore. Where are your coping skills? So I think that was very difficult for people to figure out a way to maintain their coping skills, to maintain their schedule, to maintain the things they need to help them lead a happy, healthy, and productive life. All changed. The idea of scarcity was prevalent, meaning there was not enough. I mean, you saw on Facebook, I'm sure, all these people who bought like all these rolls of toilet paper and then they're selling them for like $5, $10 a roll. Scarcity. And I think for me, one of the most obvious stressors was the increased visibility of differences between the haves and the have-nots. Let me say that again. It became much more clear, I think, to most of us, the difference between the have and the have-nots, such as when I say, you should go get hand sanitizer, and you don't have the $3 to buy a bottle. That's the reality that a lot of people we're working with, and also our staff and ourselves, that's what we all faced. Because if my budget is so tight, I don't have an extra $5 for hand sanitizer, it really can decrease your motivation to keep doing the right thing, to keep moving in the right direction, to keep making decisions that support your long-term health. And so I just want to take a few minutes to talk about how do you, for yourself, but also for the people you work with and your family and friends, how do you deal with increased stressors? Here are some examples, and I'm not going to read them all because you can do it later. But I'm going to ask you, let me see where I am at my timepiece. Okay, what I'm going to ask you to do, if you're willing, to do a quick breathing exercise with me. When we're stressed, when we're anxious, when we're feeling really overwhelmed and burdened, and we can't think. Oftentimes it's because we're in the primitive part of our brain that thinks we are in danger. So when that happens, our body releases chemicals called cortisol, and it stops producing feel-good chemicals like our serotonin, our dopamine. Because if our mind thinks that we're in fight or flight, so we might need to fight, I don't know too many people who are fighting when they're in a good mood. So brain shuts off the feel-good chemicals, we get flooded with cortisol. Our heart can really be racing super, super, super fast. Our breathing, we can start hyperventilating, and even if we don't, just shallow breaths, right? Just shallow breaths. Our hands can become sweaty, headache, stomach ache, gastrointestinal issues. Those are all symptoms of anxiety and stress in your body. So, if you will, I'm going to ask you to join me in a quick breathing exercise, and you don't have to, it's entirely up to you. So, when we do this, I'm going to ask you to breathe in through your nose for the count of 4, and I will count to 4. Hold it for 4. Again, I'll count to 4, and then breathe out through your mouth for 4, and then hold it for 4. It's called 4 square breathing. It sounds real complicated. It's not. Breathe in for 4, hold for 4, breathe out for 4, hold for 4. That's all it is. When we breathe in that manner for even as little as 1 minute, our body sends messages to our brain that says, chill out, we're safe, we're not under attack. So this is breathing you could do anywhere, anytime. And so if you'll join me, if you want, you can close your eyes. If you don't want to close your eyes, don't close your eyes. Just kind of look out at the floor a little bit ahead of you, like when you're daydreaming and you get the little soft eyes and you're not really focusing on anything. So remember, we're going to breathe in through our nose for 4, hold for 4, out for 4, and then hold for 4. And we'll do that 3 times. So I'm just going to give you a minute. When I do breath work, I like to close my eyes. I like to kind of check in with my body. Is there any kind of tension I'm experiencing? And if there is, I just notice it. Just notice it. So if you're ready, we're going to get started. And we're going to go in, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. Last time. In, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. And then just let your body return to the natural breathing that it wants to do. And the reason that I asked you to participate in that is when we are feeling stressed, when we're feeling overwhelmed, when we're feeling anxious, we literally can't think and retain information. And we're going to be talking just a little bit about information. So this is information about screening and brief treatment. So these can happen. They have to happen by a clinician. There's a 15-minute minimum duration for each of those interventions, and it can happen before admission and has to happen before admission for the screening. There's specific tools you'll need to do for the screening, and you have to use an evidence-based practice for the brief treatment and really try to provide them education about substance use disorders, how their use can be problematic and potential consequences. Also, looking to motivate them to change that behavior. So screening and brief treatment, 15-minute minimums. And brief treatment, I would think the easiest way or the easiest evidence-based, most appropriate intervention I would use would be motivational interviewing, because what this APG service is asking you to do fits very nicely with motivational interviewing. Then we have the admission assessment and individual counseling. You have some durations up there. You have minimums and maximums. Now with COVID, we're able to do all of this via telehealth services. But just keep in mind, we still need to hit the requirements for the service that we're billing. brief treatment. So what brief treatment is, which is a little different than the first one I talked about, this brief treatment is you have an individual getting treatment and care for you for substance use disorders. Okay, then something pops up. So let's say we're in group. The individual mentions that they had a little bit of they had a slip or a lapse or a relapse, however you would like to characterize it. And you just want to talk to them for a little bit after group to try to motivate them and develop a quick plan for them. So it's specific behavior or need, 15 minutes. So that's this brief treatment. Group counseling, 60 minutes minimum duration for Medicaid specifically. And you can do that through teleservices as well. It can be a challenge to engage individuals via telehealth services for group, however it can be done. Then we still have some family services, and these can happen with the individual in the session and with the individual who's in treatment for their substance use disorder, not in the session. So you have a couple options. You have family therapy or family counseling. Again, all of these services can be provided via telehealth. Make sure you're just coding that on the claim so everyone's aware that it was not face-to-face and it was telehealth services. Collateral visits, and that is where a family member comes in trying to learn how to support the individual who's in treatment with a substance use disorder. These collateral visits often happen without the individual present, and this can happen as an individual or a group service. I would think that clinically it may be difficult to get an individual who's in treatment to have their family member come in for a visit and for them not to want to be part of that visit. Also, the peer advocate services, I think, at least from my experience and what I have been seeing since COVID, that the peers have really stepped up. They've really been able to engage and connect with individuals, even though it's telehealth services, in a really productive and helpful manner. So again, you can offer peer advocate services, but the pair has to be certified. Again, billable 15 minutes and 15-minute minimum duration. So if you see somebody as a peer advocate, sees one individual in treatment for 10 minutes, for 14 minutes, it's not billable. It has to be 15 minutes minimum. Medication administration, observation, and medication management. Minimum 10-minute duration. This is where we're really talking about and trying to help people with medication-assisted treatment. So this could be for buprenorphine, it could be for Suboxone, it could be for Vivitrol, it could be for naltrexone, or even antabuse. So minimum duration, 10 minutes. Again, these services are able to be provided via telehealth services. This is your ancillary withdrawal. This is for individuals who are usually at mild to moderate withdrawal level of a substance. In order to provide these services through an OASAS clinic, you have to have this service added onto your license. All you do is you talk with your OASAS rep in the area, then you'll have to fill out, when we did it was, maybe about 3 pages, and then you develop a protocol very specific about, really it's a medical protocol, who is eligible, what treatment is going to look like, including medications, how often is the person going to be monitored, and all of those things need to be very clearly listed out, sent to OASAS, and then they approve it. There's no time requirement for that service. Complex care coordination, again, build in 15-minute increments, no more than 4 per day. This happens if there is a critical event or condition that the therapist or the treatment team needs to address. So it can't happen for everyone and it can't happen regularly. But if you have somebody who has a critical event and it's requiring a lot of the treatment team's time to coordinate and make sure the person gets the services they need, you can bill for it. IOP, or an intensive outpatient services. Again, I actually even believe this could be provided via telehealth services. I think it would be pretty challenging to hit that 3-hour minimum per day, at least 3 days per week. But you could do it through telehealth, I believe. Outpatient rehab services. Again, when you're really talking about a service that's going to last more than an hour or 90 minutes, I think it's hard to do that via telehealth services, but I'm not saying that it cannot be done. And then we are able to provide some physical health. And again, you know, you can't provide physical health services to everybody, but you can provide some physical health services to some individuals. And you could probably provide some physical health, such as you want them to come in, meet with a medical professional, or do it via telehealth, kind of as not a full annual physical, but as a health screening when they get admitted or they're coming into care. Smoking cessation services, of course, OASAS is very committed to this. There have not been a lot of changes for this service or really any of the outpatient services in the last few years that any services really have been added. So smoking cessation, it's 3 to 10 minutes. So there's no code for 11 minutes. And really, it's talking about helping the person develop a plan to move forward to stop smoking. And then there are some claiming restrictions and limits. 1 claim per individual per day of the actual visit. Only 1 rate code per claim. So with some of the services, such as there's some services that you can have for an individual to have 2 services, not 2 of the same exact services. So you can't do 2 individual therapy services on a day. But what you could do is peer support services. So you have a SERPA met with the person for 45 minutes. Remember, it's billed in 15-minute increments, so that would be 3 on that day. Keep in mind, when you're doing 2nd and 3rd services, they will be discounted by 10%. We have some APG rates for your enjoyment, outpatient, opioid, and this OTP really has more to do with people who are providing methadone. So it's an opioid treatment program instead of outpatient program. Again, more rates. So wanted to just very briefly touch on this. And if you have an interest in learning more about this, opportunities to increase services and revenue, certainly you could send me an email, and I am always more than willing to talk with somebody and give some ideas. So in the last couple years, these are some of the opportunities that Spectrum's been able to use to increase our services and also revenue. A lot of it is grant or funding opportunities, such as Center of Treatment Innovation, which we have in Wyoming County. GCASA has for Orleans and Genesee County. And that really is the goal of that program, is to help people become willing and then to help them enter treatment or recovery or whatever they're willing to do to move them closer to abstinence and recovery. Then we had the Youth Pro Social Activity. That was a program where we had people in the community between the ages of 16 and 30 getting out there, being part of their community and learning to participate in and enjoy all different kinds of hobbies and activities, just as if you and I do. There's all kinds of SAMHSA opportunities out there for grants. And then OASAS also has some opportunities for funding and grants other than just kind of the typical outpatient services. And then you also have the opportunity to increase service by getting an integrated license with the Office of Mental Health. And it might make sense now if you wanted to do that, because they're really looking at combining OASAS and mental health. I don't remember their new name or when it's taking place. So that might help you get ahead of the game. And this is our beautiful recreation vehicle where we provide all different kinds of substance use disorder and behavioral health care inside this RV. Essentially, it is a mobile behavioral health clinic. If you have any questions, we'll answer them now. And this is me, my email, and this is the APG manual that I got some of the references from. So thank you for listening to that whole spiel. I have 2 things in the chat from Lisa.
That's just for me.
Okay.
While we're waiting to see if people have questions, can you tell us more about the mobile Spectrum unit?
Certainly can. So we have the mobile unit, and like I said, it is a fully equipped clinic on wheels. The only service we can't provide out of there would be group, because it's just not big enough. But we are able, and we have the capability to see somebody in our mobile clinic, to be connected via telehealth to a prescriber. So we're able to do medication assisted treatment. So instead of people coming to our clinic in Warsaw or doing telehealth services, this is just another way, another opportunity to be out and about in the community to help people enter recovery and move closer to abstinence, or however they define recovery themselves. GCASA also has at least 1, if not 2, very similar vehicles, and they use theirs brilliantly, if I don't, to toot their horn. During COVID, they do have a methadone clinic. So they didn't want, and that's most of the time people come in like every day to get their medicine. So what they were able to do is, instead of having people come into the building, they were able to figure out something that they use the mobile clinic for social distancing and to help people feel more comfortable.
Does anyone in the webinar audience have any specific questions about billing and coding or adapting to COVID circumstances for Julie? Not seeing anything come in.
And that's okay. If you don't have a question today and you leave here and you go back and you think of a question, or someone asks you a question and you need some guidance, you can reach out and we can provide those answers to you via an email. That's perfectly okay with me.
Absolutely. I don't see anything coming in. So Julie, thank you so much for the information. We appreciate it. And for your beautiful backdrop. You're putting me to shame here with my dark gray. You look like springtime. So thank you for that. Next week, we have a new topic. Stigma is an enemy to effective recovery support. Erin Pownall Burns, who is a certified recovery peer advocate, will be here with us. She presented last year as well, but she's got a new presentation for us, so we're looking forward to that. And I'm going to share my screen again so that you can again see my email.
And I just wanted to say thank you all for participating. Seriously, if you have any questions, just send me or Lisa an email. We'll make sure you get the information. And the last thing I want to say is when you're feeling stressed or overwhelmed or frustrated, just breathe. Long, deep, slow in, long, deep, slow out. It seems like it doesn't work and it's ridiculous advice. But I think if you try it, you'll actually find that it does work. And if you're a research nerd like I am, you can go on and you can Google, and all kinds of studies show that mindfulness and breathing helps with that. So thank you.
So I would have to agree, Julie. And next, the week after next, after our stigma talk on the 30th of March, we do have Catherine Cook-Catone from the UB Graduate School of Education here, and she will be talking about self-care and how we can build up our resiliency being in this challenging field. So please join us next week and the week after. And if anyone is interested in attending our conference day, we do have a conference coming up in April. It's a half-day in-person conference. We'll be socially distanced. We'll be really watching our numbers. So if you'd like to get on our website and also join us for that registration, you're more than welcome to. Have a great day, and thank you for continuing to choose hope. Bye, everyone.